Hey guys, just want to start by saying thank you for everyone for being here and taking the time to learn and allow me to share a few of my opinions and what I've learned over the course of my short but exciting career so far. Clinical excellence, I think, is really what will set us apart from the corporate monster that's coming around everybody's corner. And aesthetic clinical work that is optimizing all the aspects and tools of what we have available to us for every patient, I think must be the standard for our profession going forward. Today, I'd like to talk about my viewpoints of the current status of the orthodontic landscape. We'll talk a little bit about the exam room and how to communicate with the patients to help them align treatment objectives to what we are trying to achieve. And our job in the exam is to help communicate all the things that are possible for them to obtain the optimal result. And in many cases, for myself, that is letting them know that braces might be the better choice to achieve the goals that we would like to set out to get. I'd like to expand on 10 key points that I have that every orthodontist should be focusing on, and then ultimately deciding with the patient what modality, after we've outlined what 10 key points we'd like to achieve, is going to be the best to achieve what they would like to get accomplished. So, with that being said, first, I'd actually like to start a little bit with my journey and share a little bit about my family. This is little Miss Ariana. She is my firstborn. And when I first started putting presentations together, I started with this slide here. And obviously, it has expanded over time as I have continued to grow. But I would start with lunch and learns, and I would take the photos of my family, but also the photos of my clinical work and just share them in these lunch and learn settings. And that has been a huge driver of referrals from dentists to my office, just because if you do great work, take great photos, and then show them off, I think that is a great success, or sorry, a recipe for success, because it's undeniable if you can just show people what can be accomplished. Little Miss Ariana is growing up, and we've added another addition, Mr. Little Alexander. Alex is growing up, unfortunately, as well, and he currently is 1.5, and Ariana is 3. Back around Thanksgiving, me and my wife messed around and found out. And we're having another baby, which was a surprise. And the even bigger surprise was, if you can see up in the upper left corner, it says baby A. So we're actually having another baby as well. We're having twins in about 3 weeks from now. So my whole life is going to be turned upside down. We're going to have 4 kids under 4. While I'm super excited and grateful for the journey, I do understand the huge task that we're embarking upon with having so many children, so short apart. So, um, good luck to me. But my journey orthodontically, I graduated from Eastman Institute at the University of Rochester in 2019. And when I graduated, my original plan was to go work for an established orthodontist, learn the ropes of running a business, learn the ropes of running a quality practice. And I was headed back to my hometown to work for the person that originally did my brother's braces, actually. But I got there on July 8th of 2019, and by September 5th of that year, he pulls me into his office and had a very upfront conversation, letting me know it wasn't working out already and that I could either buy him out of his practice or I knew where the door was. And I really wasn't ready to buy a practice. I already was feeling overwhelmed, but I felt that I came to Wichita because I wanted to be close to family. And this was maybe a good opportunity for me to jump all in on. So that's what we did. My wife and I purchased the practice right at 2020. And honestly, I felt overwhelmed, underprepared. Every day of clinic was like walking in and drinking through a fire hose. It was probably the toughest 2 to 3 years of my life, just trying to get a hold of the clinic, feel confident about what I was doing, and feeling proud of the work that I was doing, which was very difficult in the beginning. So it put me in this position to really start diving into continuing education, which I'm so glad I did. And as you already kind of know from January 2020, 3 months later, we ran into COVID, which was just another huge shakeup for me. But in that 7 week period in which we were closed, all I did was watch webinars that were available. Everybody seemed to be putting out something. And through those webinars, I came across this photo, and this photo was very eye-opening for me. And what we're looking at is a mom in the middle with her three daughters on the outside. And the two daughters on the farthest sides of the photo had treatment by a specific orthodontist, and the two daughters in the middle had treatment by two different orthodontists. And what this showed is the objectives of the orthodontist can profoundly dictate the aesthetic result. That just putting brackets and wires on and straightening the teeth is not enough, that we have the ability to create a smile versus just sliding things up and improving upon the aesthetic of it. I think when I was going through residency, I thought that, people were for the most part just set, and my role was to line things up the best that I can. Um, but diving into all the things that I saw after I graduated, you can really change the entire lower third of the face just by positioning teeth in the right vertical dimension, rolling the occlusal plane in the right dimension, expanding and broadening out. I think width is so important to the aesthetic. And then as I saw things like this, it led me to go into a 2 day master's course, or sorry, a 2 day PITS course. And the things that I saw there blew my mind away. It was by far the best aesthetic work that I've ever seen anywhere. And I immediately signed up for the PITS course, and it was the single best decision that I have made for my career. This is a very candid conversation with somebody who messaged me just saying, "Hey, how did you start in this PITS process?" And I laid it out for him just as I did just now. I started a 2 days course, and it was the single most profound thing I did for my career. And looking back now, I'm so glad that that previous doctor put me in that position, because had he not, I would be doing the same things that he was doing as he learned over his course of his career. And I would be in this very traditional niche of orthodontics. And because I was forced to evolve and dive into the progressive aspects of this orthodontic community, I have been able to transcend what I would have been and become what I consider to be an aesthetic orthodontist, which I understand why that's probably a silly thing to say, because all of orthodontics is considered to be aesthetic work. But there's these things and fine points and objectives that I'm trying to get accomplished that I just don't feel are commonplace, and something that we will just expand upon in a little bit here. In 2023, I bought my second practice. I was approached by a doctor across town, and he was a 90% aligner practice. So I was like, hey, aligners are easy. I can get that accomplished without much issue or hiccup. But that turned to be a little bit of a nightmare, as well as I learned that compliance, you have to be very smart and specific on who you will treat with aligners, and making sure that people are on board and understand the responsibilities of it all. So that practice originally started about 90% aligners, 10% braces. Ultimately, today I've evolved it back to what my original practice is, which is about 70% braces and 30% aligners. So lesson learned there. And now I'm in a fortunate enough position that the legend himself is taking some of my cases across the country and showing them off. So I'm very humbled and honored to be in the position that I am for such a short period of time that I've been doing the program. Um, Orthodontics is in like a weird position. I think we always think of the past as the golden age. Uh, but I think it's just a unique time. Students are coming out with incredibly leveraged student debt, five, six, 700,000 or more. Corporates buying private practices at a, you know, huge rates over asking price or what traditional prices should be. And then high corporate salaries are taking new residents that are highly leveraged with debt and sticking them into their corporate positions because they are under the need to be able to produce a lot of cash for themselves to be able to just live and thrive for their own personal life. So it's put it in a position where the private practice model is maybe diminishing a little bit, but it is still strong. And I think it remains the most empowering and most rewarding path for us as doctors. When I was going through residency or dreaming of being an orthodontist, I didn't dream of working for corporate. I dreamed of working for either myself or a very like-minded individual to be able to cultivate the smiles that we want to have produced in our practice. But it's not without risks and it's not without challenges. And I think it's really just through differentiation and exceptional work is what is going to continue to drive the private practice model. Our ability to go the extra mile, our ability to spend time with our patients and invest in things, equipment, um, more knowledge than our counterparts can, I think, in corporate situations is just going to allow us to be the next step above, in my opinion. But success requires not only a financial commitment, but a full mental buy-in as well. Like you have to be, I think, to be the best that we can, it has to consume a little bit of our life, not only just being in the practice, but this commitment to continually grow and be better and thrive in these times. And it comes through being uncomfortable. And I think often what's holding us back is just fear. Fear if we're running a well-oiled machine practice, seeing 60 to 90 patients a day, and I want to switch something up, what is that going to do to these days? It's going to create headaches and it's going to create problems that we'll eventually have to solve. And if it doesn't work out, then we'll have to walk it back. Um, or just fear of investment, of taking the time or the risk. In my experience, you got to go for it. And if you do, it'll pay you back in a multitude of ways. So if you're thinking about something and you want to take the next step, just take the leap of faith and believe in yourself that you will figure it out along the way. Because greatness really requires us to risk failure and then embrace a challenge. And you have to understand that you're not going to have all the answers. I think orthodontists are very much type A, and we want to have all these answers before we move on to the next step. Uh, Fortunately for me, I feel like I'll figure it out along the way. And so I just jump in, commit as much as I can of myself to either learning something or following a prescribed prescription of mechanics. And then I will evolve and figure it out along the way. And we have to push our limits. Otherwise, we are just going to settle for mediocrity. And we're going to be the same orthodontists that we were 5 years ago, 3 years ago, 10 years ago. Which, if I am the same orthodontist that I am now next year, I will be severely disappointed in myself. So I'm continuing to keep the limit ahead of myself to continue to strive for better for my skills, for my patients, and for the people that I get to work with every day. So I encourage you to do the same. Make sure that you are not settling in, making sure that you are staying outside of your comfort zone to continually grow as an artist and a clinician. Truth be told, I think aligners are awesome. I think you can do amazing things with them. And that's not what this talk is about. It's not to dissuade you from doing aligners. I think when I get into this talk a little bit more, it's more to highlight what the capabilities of us as orthodontists are, and then when braces is the best modality to get the most out of the outcome that we're looking. Um, I've seen it a lot. I've done so much continuing education on aligners. I've done every master co-op course there is, every aligner fellowship there's been. And then I have a whole spreadsheet of protocols that I have that I just, cut and paste into my approvers these days. And I think I'm slated to do probably around 150 cases this year for aligners. I believe in it. I think it's a great modality, but I think it's very case dependent and very patient dependent. to making sure that we're not only choosing the right cases, but setting the right objectives and making sure that patients know what is possible. And then if they are going to not want to get the most optimal because I can't do it with aligners, that they also know that as well. This is just one of the cases that I have. Like, I feel I can do really great work with aligners, but it's really based off of predictability of outcome, patient expectation, and then patient compliance. So, aligners are going to come to our office. People are going to ask for them. We already know this. Adults are the largest market share. Teens are growing. The expiration of the Invisalign patents has really helped our profession, helped the diversification of this clear aligner market. And I think there's been a ton of innovations that'll be continuing to just grow the capabilities of aligners and what they can get accomplished. I also think AI is going to be incredibly impactful as far as the aligner market goes. I definitely envision a day where we can say, hey, just give us the same protocols and movements that the master co-e people do and do it on this case. And some AI is going to put it into motion for us, which is a bit of a scary thought. But again, when I come back to some of these key points that I'll touch on here throughout this talk, that is what's going to distinguish us from just lining teeth up, which anybody can do. The fortunate thing is Invisalign's marketing straight to the consumer, so they're coming in asking for it, which is fine. I just want to get them into my office so I can educate them in the exam on smiles and aesthetics and what's possible with aligners and what's possible with braces. So I think, in my opinion, that's a really great thing because it's our role as a clinician to steer the conversation and then direct them towards the modality of treatment for the outcome that we want to achieve. But like I was talking about, aligners for me are very much case and objective dependent. My primary considerations for me when evaluating a patient's candidacy are really the patient's personality, making sure that they understand the burden which aligners are. I've done aligners twice. It is a commitment. It is a hassle, in my opinion, to keep track of them, take them out, keep your teeth clean, pop them back in. And time goes by quickly when you pop them out and you realize, hey, it's been 2 hours. I've got to pop my aligners back in. The patients come in with some level of desire, right? Everybody has a chief complaint and what has driven them into your practice. Hey, I want to, get the upper left tooth rotated, or I had braces as a kid and my teeth have relapsed, or maybe it's their first time going through orthodontics. They just want to have a beautiful smile. But then comes into my part where I have to understand what they really need to get to the best possible position and then explain my knowledge of what's possible for them. In my exam room, I just have a TV on the screen for when I'm not there, and it's just playing slides of before and afters of an assortment of cases. And that way, when I walk in, I'm going to have somebody that's very similar up to them. And I can say, hey, like, this is what you look like. This is a before and after of what I have that looks very similar to yours. And this is a smile that I can create for you. But here's the way that I need to get it accomplished. And just laying it out for them so they understand that, you know, they can see this transformation that's possible. They can believe in what I can get accomplished. Understand that I can do it for them, and allows them to trust me that maybe my recommendation is going to steer them in a direction where their outcome is going to be the best that they can be. And then after I talk about some of the objectives, I have to really take a look at myself and understand, they might be pushing for aligners. Can you do it with this? Can you make that happen? Uh, but I have to be able to have an honest conversation with them because ultimately I don't want to set my clinic up for failure and falling short on the commitment that I've made to them to be able to produce what we've talked about. With that, I'd like to jump into a couple cases and we're just going to do like a rough diagnostic and then we'll get into the key points that I'd like to make today. So let's jump into some diagnostics on a couple patients real quick and just make a rough treatment plan on what things we need to get accomplished. And so when I like to start my evaluation before I go into the exam room, I like to start with just the facial smile photo. Just cues me in on a couple things for the patient. Like for this lady, she got her hair done, eyes done, lips done, makeup on. Obviously very aesthetically aware. Got a very nice smile. Um, And for her, she was actually a relapse case, had been treated as a teenager, had some, obviously, you can see the centrals are overlapping there, and just want to get some cosmetic work done. I'm going to jump into this one. This is my next, actually, probably my most important photo that I like to base my treatment decisions off of. How am I going to position these teeth within the frame of her lips to be able to get the most aesthetic result? Obviously, gummy smile. We got some over eruption of her central incisors, very narrow buccal corridors. I can assume from the extractions, they just had to constrict everything down to close the spaces. This photo is like a cheat code for me. Honestly, I love this photo, especially as I'm doing my actual treatment and as I get close to debond. I just have these photos taken regularly throughout treatment. I will blow it up on the big IMAX screen that we have in the clinic, and I can start to pick apart all the things that I'm deficient in for my smile that I need to improve upon. And it becomes very evident when it's staring you in the eye on a big screen in front of the patient. And it's really a great tool to be able to fine tune some aesthetics and things that I often miss if I'm just having the patient lay back, or even if I'm just having them smile in front of me, because it's hard to get them to hold that smile for a little bit. Next would be the intraoral, and we can see just a little bit of an edge-to-edge bite, some anterior wear from that edge-to-edge bite, some good constriction, some mild generalized recession. Not too difficult of a case. I think either aligners can certainly fix her bite. Aligners can certainly get these teeth straight. But when we come back to, the close smile where we have all this excessive gum display, and if I'm trying to treat her for a gummy smile, aligners for me become very difficult. So we really have to plot out what her objectives are going to be. And if she just wants to straighten her teeth, then great. And if she wants to go for the whole thing with expansion and gummy smile treatment, then for me, that's a little bit different of a conversation. Another beautiful young lady, makeup done, eyes done, lips done, a little bit of lip filler as well. So obviously very aesthetically aware. She had previously done aligners, didn't do great with compliance, but felt that she was ready to start again. Came in asking for aligners as well. And for her, she's just a little bit insufficient in her tooth display, as well as the buccal corridors. And then really for me, her tooth proportions, I would like to fix quite a bit as well. Laterals, maybe they're small, but the centrals I also feel like are pretty big. I'd always, not always, but in this case for sure, I would start with just reducing the size of the centrals and starting to see how those proportions look before I just jump to building up laterals, because that becomes just a commitment long term for them to have to be able to maintain. Whereas if I can create the natural tooth shape and size and proportions that is most aesthetic, it just makes the maintenance for the patient easier. And then ultimately, long term, I think they're happier. Um, for us to take something away from this presentation, I'd like to step back a little bit and allow us to start communicating on this, aesthetic priority and diagnosis table. Fortunately, one of our colleagues, Dr. Trevor Nichols, has come up with 10 principles for the aesthetic orthodontist to focus on. And when I sit with my TC to discuss these exam room patients and come up with our treatment plan, I'm really trying to look through all 10 of these principles to see if I can do it with aligners, if I can do it with braces, what's going to be the easiest, and how can I ensure that I'm getting the best result for the patients. Because honestly, making the patient happy is probably for most patients the easiest part. Um, I also want to be super proud of the work that I'm putting forth. And honestly, I feel like to make me happy of the result that we get, it's very difficult, and I have to make sure that I'm hitting every nail on the head there. Because I have this vast knowledge and I've seen all the great things that can be done. And I want to make sure that the outcome that I'm producing for the patients that choose to do care with me is going to be the best that they could have gotten anywhere else as well. And if we're not practicing with that kind of responsibility, then honestly, we're not treating ethically, because we should always be trying to do the best that we can, the most that we can with all the available knowledge that's out there. One of the big things is facial profile and lip volume. And really, this is about controlling vertical dimension for me. This is Edwin. He just started in my practice last week. And obviously, he's very overclosed, very brachyfacial. And with that profile, you can assume he's got some class 3 kind of bite going on. And if you assume that you're correct, he had a pretty big underbite. Front to back wise, his molars were in like a class 1 relationship. But just by opening up his vertical dimension, and this is the day that we bonded him, we have completely changed his profile. His chin is now a little farther back and down. We've elongated his lower third. Obviously, his upper lip is a little bit deficient, and that's because his upper arch was so squared off from being in that anterior crossbite that as I get these teeth to come forward, I anticipate getting a little bit more gain of that upper lip support. But with this kind of bite and being so overclosed, it's not a matter of just an anterior posterior discrepancy. If we are using vertical in our treatment plan to be able to help correct, making this jump is super easy. Like I anticipate him to be over this bite within 6 weeks. Now, to send Edwin home like this, like I got to make sure he is very understanding of what we're embarking upon and why it has to be this way to be able to try to get things appropriately positioned, because this is obviously super awkward, very uncomfortable. Um, but you can make these dramatic changes in a very short period of time. And then so this was his initial buckle shot, and then this is where we left him off at his bonding appointment. The whole game for me from this point is managing his vertical to help control his chin projection and the fullness of his lips. You can see the very upright nature of his upper incisors. The sloped ramps on the lower ones are going to help procline those. When he slips off of those ramps, he's going to close down again, and I'm going to lose a bunch of vertical. But in this position, while I have him opened up, we're just running extruding elastics. I don't have class 3 elastics going here. I'm just running extruding elastics in the posterior to try to gain as much vertical support as I can. And then when he slips over, I have to find a new spot to open up vertical with a new occlusal pad, and then continue to extrude both in the posterior and the anterior, but not simultaneously. So just by changing vertical, we also change the frame of the smile in which they are smiling with. When we're over closed, it's this very small frame. And then when he is open, we have a much larger frame. And now we can see this window, which I have to start building the smile from. And I can use this as my reference to be able to know exactly where I need to go, how much I need to open them up, and how much I need to get these incisors to come down and roll that occlusal plane to be able to tip into the frame of his smile, and then ultimately set his bite up at the same time. It works just the opposite way as well. And this is a case I'll show a little bit later in the presentation. But she had an anterior open bite, very vertical. And as we did some intrusion and impacted her upper jaw, that chin came forward, that projection of her chin came forward. And where it was behind her lower lip before, as we finished, it was in front of her upper lip to give her a very full and straight profile, with some great lips and a great looking face at the end there. I just want to emphasize how much controlling vertical really changes the lip frame, because as we start to expand and intrude or whatever the case needs, we can really start idealizing the lip frame as well if we're controlling the vertical as well. Vertical is a very powerful tool for class 3, class 2, and obviously smile aesthetics as well. And in a world where corporate offices are offering $3,500 treatments and $1,700 Black Friday deals. Like we have to be able to distinguish ourselves to be able to say, hey, not only am I going to straighten your teeth, I'm going to change the whole way that you smile. I'm going to change the whole lower third of your face to be able to give you more lip support, a better frame for your smile, and really be able to position these teeth appropriately within that frame. The next one, I just kind of combined two of them, alignment and contacts, and then tooth shape and proportion, because they kind of go together. Alignment is the bare minimum, right? This is what the public expects from us. When you go to the orthodontist, you get straight teeth and they look better. But that's the minimum. The second word in that number 2 would be contacts. And this is where I think so much can be left on the table. because how the teeth meet together really dictates their aesthetic and flow from front to back. And that's also where tooth shape and proportion comes into play as well. We have to be able to modify the tooth shape and proportions to be able to make the contacts come together, to be able to allow the smile to flow really nicely. So this is a case that I had worked through. And honestly, it's like the dreaded tooth shape, the tapered tooth shape where it's wider at the gingival than it is at the incisal edge. And so I knew that I'm going to have to do a lot of interproximal stripping, especially in that gingival area, which everybody hates to do because you're going to impinge upon the gum tissue, and the patients really hate when you do that. But in my opinion, it's definitely worth it because if we can do that, we can take that tapered arch form and get these teeth to start to come together with long connectors, appropriate embrasures, and then we're not distracted by all this negative space in between the teeth from those tapered teeth, which ultimately I think is a terrible looking smile if we just finish with these tapered teeth and either doing buildups if they are too tapered or if you have enough tooth structure to reshape them interproximally to be able to create the tooth and the tooth shape that you need. We want the tooth or the smile to flow from front to back, and this is just kind of highlighting the smile arc that we have in there. But it's not like this difficult scientific game that I think a lot of people or that I see often. I feel like I don't need this grid. You don't need to have proportions and measure out percentages of what you're seeing. You don't need these proportions and doing some math problems in clinic when you're seeing 80 patients a day. Just polish down until it's a good looking tooth. And if you think it looks great and it feels like the proportions are matching the eye test, then I really feel like that's all it needs. And you'll develop this eye to be able to create the tooth that you need. And it's like a piece of marble that you're just carving out this piece of art into. This is one of my favorite transformation cases. This is not mine. This is Dr. Trevor Nichols's case. And this is just inspirational to me because if you have these long, worn teeth, it's just an opportunity to be able to reshape into something that is really magnificent. And this is the toolkit that I use to be able to get those things done. The IPR disc is critical. I just have a zero point zero 0.02 or a zero point 0.2 millimeter disc that's cut on both sides. And if I just need to do one side, I just lean a little bit harder to be able to reshape and kind of round the edges as well. All the burrs here that I use, I actually have a yellow diamond burr that I use for facial polishing as well to make sure that the light is reflecting appropriately off. But with this toolkit, you have the ability to sculpt and treat and shape any of the teeth that you need to be able to be the tooth that you need it to be. Smile width, I think, is one of the things that impacts the aesthetic of the smile the most. And it's just making sure we're broadening out those arches to their fullest extent. And this is where I feel, for me, aligners can be a little bit unpredictable and maybe fall a little bit short of what I'm trying to get accomplished. I know there's lots of theories on how to expand, just adding like a ton of lingual crown torque and just drawing it out. Or if you follow the Master Coep way, it's, compress the sevens and roll the sixes out with the premolars. I just find with braces, I get a more predictable outcome. And in a relatively short period of time, I can take someone with these huge negative buccal corridors and fill them out in a matter of 8 months. To be able to have a really wonderful transformation and just know that I don't have to worry about creating an open bite if my expansion's rolling out and I have anterior interference now because I've been flaring my posterior teeth or have to run posterior elastics to close my bite down with aligners. So in a case that's really buccal deficient, I try to lean on braces because I know that I can get predictable expansion. Smile Arc, this is not anything new to, I think, to the orthodontic community. And it's been around since 2001 when Dr. Sarver introduced it. And it's just this idea of the smile flowing from front to back, with the lowest point being the central incisors and the incisal edges kind of following the borders of the bottom lip and the gum line following the border of the upper lip. And while Dr. Sarver started this idea of Smile Arc, Dr. Pitts has been really the one who's contributed the practical and kind of the biomechanical implementation of the smile and how to get that done with fixed appliances. And this idea of what's called smile arc protection, or SAP, that Dr. Pitts has coined, really emphasizes the importance of preserving and enhancing the smile during treatment. And the way that we do that is just bonding on a gradient, essentially. And so it's not, I get this question often of like, why do you put your brackets higher? Or people think it's a gimmick. And it's this world that we have of customization. It doesn't make any sense to me that we just put the brackets in the same spot for everybody, because the need is so variable versus or on incisal display, and what the patient needs for aesthetics. And so all that SAP is really just customization of bracket position to be able to elicit the changes in incisal display to make sure that we are filling in the frame with the beautiful teeth. And this is kind of an example of a transfer case that I had come in. They were moving into Wichita. They were told they needed maybe an appointment or two left just to get their bite to settle. And I told the family, I was like, hey, her bite's great, her smile's great, but I think I have some improvements that I can make. If you can just give me maybe 3 more appointments and allow me to take some brackets off and put them in a new position, I'd like to really develop her smile a little bit more to bring her teeth into her smile so that she can have a young, youthful, age appropriate smile for the rest of her life. And it's not a matter of having the Pitts brackets for this situation. It's just a matter of bracket placement. And while I will say I've tried it in Twin, I've tried it in Empower, and I've tried it in Pitts, and I wouldn't want to treat any other way that I currently do at the moment, which is with the Pitts bracket. Upper tooth position, again, we just kind of talked about that, making sure that we have all of those incisors into the frame of the smile. And we do that through the bonding techniques that Dr. Pitts has coined. Extrusion is the hardest thing for me to get accomplished with aligners. And again, there's variable techniques to do that. I know Dr. Yvonne of Master Coeep's technique is to kind of finish the case and then just wear extrusion elastics upper 2 to 2 from the linguals of the upper 2 to 2 to be able to pull them down to the position that he wants to finish in. For me, it's unpredictable and something that I'm not very good at. So I just choose to bond a little bit differently to be able to get those teeth to roll down into the frame of the smile and get that occlusal plane to frame up the teeth in the right position. This is a Dr. Ilias case. Dr. Ilias is a teacher within the master's program for Pitts. Honestly, um, he is one of the best orthodontists that I think I've ever seen. The skills of the Algerians is unmatched from any other lecture that I've been to. If you have an opportunity to go see either of them, it's a really special thing to see. Both Ilias and Wasim are incredible orthodontists. This is a case of mine, and it's just kind of the opposite. We don't want too much gingival display either. We want to be able to bring the teeth up into the smile. So learning how to do gummy smile as well as accompany it with some level of a gingivectomy is going to be a really important tool to the practice. And again, just being able to shape these teeth. She started with some good shape, but at the end, it really looked like she had gone through some cosmetic dentistry. And in reality, it was just tooth shaping, polishing, properly framing her teeth within her lip frame, and then taking care of the thick gum tissue by beveling with a laser to be able to get everything to be the right size, shape, and proportion. Midlines and occlusion, you've all seen it. I'm not going to show you cases of midlines being on and class 1 socked in molars. Like, you get it. It's the basics of orthodontics. It's a primary key of what we should all be getting accomplished. There's no slack for occlusion because we're working on aesthetics. The occlusion is the base goal, and then aesthetics is just the addition to what we can get accomplished. As we talked about, tooth shape and proportion, and then gum display and shape as well. Getting more into the gummy smile, it's just a really wonderful tool that if you're not doing TADs, I would strongly encourage you to start doing TADs. I can't do this kind of transformation with aligners. It doesn't need surgery anymore. Sure, she could have had aligners and gone through a LaFord impaction. But over the course of like 2 years, we can get this accomplished with braces non-surgically and have a really wonderful transformation when it's all said and done. And so for me, in situations like this, it really just becomes a matter of commitment from the patient and then execution on my part, with braces being the main choice. Gingivectomies, imperative. I didn't start by doing 5 to 5s. It's a very easy thing to learn, and I started just doing 1, 2. Hey, let me expose this canine, or hey, I think, your upper left one, your margin come up a little higher. Do you mind if I do that? And for about 2 years, I just did them for free because I wanted to hone in my skill and feel like it was a value to the patient to be able to have this treatment done. And now that I feel like I'm pretty good at it, I don't have a lunch until October because they're all filled with gingivectomies and things of that nature to be able to get done where I need to sit down for an extended period of time. This is the laser I use just from Bob Cobley. Highly recommend it. I don't get any kickbacks from any of this. It's just the tools in which I like to use, and I think it's the best out there and used primarily by those that I aspire to be like. And so I just use what the good people use, and it seems to work out for me as well. But it really allows you to put the cherry on top of the case. If you're going to do any kind of TAD case, you're going to get some overgrowth of the gingiva. And it's just so anticlimactic to do a debond and have one side be slumped with gum tissue and the other side looking great. And you've done all this hard work to get everything to where we want it to be, to ultimately have it be a deflating debond because the gum tissue is hiding up all the beautiful work that we've been able to do. It's great for inflammation. It's just a really great way to highlight all the aesthetic things that we've been trying to get accomplished throughout the course of treatment. And then tooth color obviously is very important to people. So making sure at the end of treatment, what we do is I give a couple whitening kits for them to just take home, just the hour, put it on there, helps bring them up a couple shades. And people really find value in that. And then if they want to, I tell them, hey, if you want it to be wider than that, come back and I have some stuff for you can get to be able to find a higher shade if you would like. So coming back to this case, my primary consideration for me when evaluating their candidacy for aligners, like we talked about, one is, are they going to wear them? They have to be able to wear them. If they have to be able to be committed to it, and I want to be very upfront with it's an ordeal. Like I have aligners for myself right now, and it's a burden to be able to try to keep them in as much as they're supposed to. And I want to make sure that they have some level of investment responsibility in the outcome that we're trying to get. I want to know what they want to know or what they want to get accomplished. If they're just trying to get some laterals straightened out, they're a relapse case, they're pretty happy with their smile. That's good information because I'm not just going to come gung ho on, hey, let's treat this gummy smile and that's the only option for you, because in reality I'm here to serve. So if that's what they want to do is gummy smile, wonderful, then I'm here for it and I can execute on it. And if they don't, if they just want to get this lateral straightened out, then that's your prerogative and I'm here to just help you out in that journey. um, but then becomes, where I start thinking about what does this patient actually need. Do I need to do a gummy smile? Do I need to straighten teeth out? Do I need to reshape these teeth? How are our proportions? So I can talk to her about all these things. I have to know what's possible for her. I have to know how to treat her, and I'm making sure that I have the ability to match whatever I'm going to be able to talk to her about. So things that I can affect with her on aligners is certainly alignment and contacts. Smile width, I put a little asterisk both on the width and the arc because she's got some good arc to her smile. Her teeth flow pretty well already. And she is constricted, but I certainly can expand with aligners. I'm not going to say that you can't. I think I can definitely get wider and make sure that our arc is more basically just perfect with braces. But it can be affected for sure with the aligners. Making sure our midlines are on, making sure our occlusion, there's no cutting corners. And then tooth shape and proportions, and then shade as well. So with aligners, I can get a lot done. I can give her a really good smile. I can give her really beautiful teeth that we've created and shaped. And I can match a lot of things that she was coming in looking for. But it's important to know the things that I can't do as well. And so I'm not going to promise that I can change her vertical. I can't affect the full width of the smile. I can't say for sure I'm going to get the full smile arc, but it's going to be pretty darn good. Upper tooth position, just gum display basically, how much tooth display she's actually showing. I would have really enjoyed doing a gummy smile treatment case for her, but ultimately she ended up saying, hey, I'm not here for that. I'm here for these front teeth and these lower teeth that are crowded. And if you can just straighten those out, then I'd be happy. And so I said, absolutely, I'd be happy to do that. And she is a Spark case that we're starting, and I'll be able to get a lot accomplished, just not everything that I could possibly have gotten accomplished with braces. And so just the other one, like we've talked about, compliance. They need to know, I need to know what they want. They need to know what I can do. I have to explain that for them. I have to make sure I'm walking them through. So I don't want to have them just come in and say, hey, I want this tooth correct. And I'm like, yeah, that's great. Let's just fix that tooth. I do, for her, I talked to her about, filling in these buccal corridors. I talked to her about bringing down those teeth and reshaping them a little bit, to really frame her up a little bit better and open up that lip frame just a bit by opening up her vertical so she can show off the beautiful teeth that she has. And then knowing my capabilities to do that with aligners and braces is really, really important. So things that I can affect, the alignment and contact. I can shape those teeth, make sure everything is coming together really pretty. Smile width certainly can expand, but not to the extent and predictability that I could with braces. Midline should be on, occlusion should be on. All the tooth shaping and proportion work, I can do that just with my burrs and IPR desks. And then certainly getting our whiter teeth is something that we would do after treatment is concluded. Things I didn't feel I could trade with aligners. The lip volume, smile width, smile arc, upper tooth position, and then gum display. To be able to really take this almost reverse curve smile arc that she has and bring that upper 3 to 3 really down. I need the mechanics of the braces, elastics, and occlusal pads to be able to create the moment to roll that occlusal plane down. And I'm really excited for her because it's going to be a transformation from a really good smile, honestly, to something that is really great because I've hit all of those 10 key points that we've worked around, to be able to shape and give proportion. And so I really think it's about setting the stage for these patients on what's possible and what you can do, and then what your capabilities are on delivering those. Aligners are great, but braces for me are more predictable. And I think I can do more with braces at this point than I can do with aligners. And so oftentimes where there's a need for incisor display, where there's a need for width, and I'm trying to do more than just align, I'm really trying to frame the smile well. Braces is a fall to or go to in most cases for my situation. If you would like to develop your skill, which we all should, I would say mentorship is a must. Dr. Trevor Nichols is a pioneer, I think, in our orthodontic space. He's a very special person. He's a very special orthodontist, very aesthetically attuned. And if you have an opportunity to speak with him or learn from him, I would highly encourage you to do so. Um, Mentorship has been a key accelerant for me, and something I would say we all should do more of is to either be mentored by somebody or mentor somebody to be able to help those that are looking to learn. And as I talked about earlier, the Pitts Masters course, it's the most pivotal thing that I've done for my career, hands down. It was the single best decision I've made in my orthodontic career. Dr. Pitts is instrumental in where I'm at today. And the thing that's so great about the Pitts Masters course, it's the immersion. You're there for 4 days, twice a year for 2 years. You bring your own cases. They show amazing things. And it was really an eye-opening thing for me. And that's what really shaped my vision of orthodontics now and set the bar for me to be able to shoot for, is seeing all the great work that had been done that I hadn't really seen before in many CE lectures or even in my orthodontic program throughout my career. So Tom's a legend, and the community has some of the best orthodontists in the world, in my opinion. And the commitment will set you free when you have the ability to say, "Hey, I do this. Like I do pits. That's all I'm going to do. I don't do any other bracket. I don't do a twin bracket. I don't have twin for phase one. I just do pits for everything. It's very predictable. I know what expansion I'm going to get. I know the mechanics to use. I know how to run the elastics. I know where to put the occlusal pads. This is all part of the Pits Masters program. And while you can't just go to this program and then you come out on the other side, this amazing orthodontist, you have to go home and you work on it and you go to the first class and you're like, oh, I'm going to try bonding higher. And you bond a little bit higher. And then, like, over the course of 6 months, you fall back to a more comfortable position. And then you go back to the second one. And then you're like, oh, I got to get them up. I got to get them up to where they need to be for this incisor display. And then you keep them up a little bit longer. And then you kind of start falling back because things get uncomfortable and not everything plays out super well initially. But through commitment, you continue to progress and ultimately you just become immersed in it and it becomes part of your daily activity and then you learn the skills that you need to learn through repetition and it becomes a really wonderful spot to be in as far as practicing. I'm very happy with the work that we do and I'm very proud to have gone down the path that I have. I hope it was helpful for you today, guys. I really appreciate you guys spending some time with me. I feel very humbled. Please feel free to reach out if you guys have any questions. So many people have mentored me. I'd be happy to share any insight or knowledge or slide or perspective that I can. If it's about aesthetics, wonderful. If it's about running a practice, wonderful. If it's about graduating and going right into private practice, wonderful. I'm open to any kind of collaboration. So, with that, thank you very much again. I hope you all have a wonderful night and a wonderful rest of the year.